Hi, my name's Karen. I'm one of the midwives at Expert Midwife, and today I want to talk about bleeding after your baby is born. So I think what we'll do is talk first about immediately after your baby's birth. So once your baby has been born, no matter how your baby has been born, you will have some bleeding. So if you have a normal vaginal delivery, if you have an assisted delivery with forceps or ventouse, or if you have a caesarean section, there will be some bleeding afterwards. Now, this can come as a little bit of a shock for some people because obviously you haven't had a period for 9 months, and this bleeding suddenly starts to happen and you're thinking, oh, what's this? Is this normal? The bleeding is different bleeding. We'll talk about that later to what your normal period would be. So basically, the bleeding that you have straight after the birth can sometimes be quite heavy, and I think that's why it can be a little bit of a shock. So it can be heavier. You might find that when you get up straight away after the birth, that you have a bit of a gush that comes out. So that's because you've been laid on the bed, cuddling your baby, and you've just been there a little while. So when you do get up, that blood has pooled there a little bit. So make sure that you either get some of those really big pants that you can pull up that have got built-in absorbent sanitary towel in there, maternity pad, or get some, a couple of really thick maternity pads. So when you do first get up and want to wander about or go to the loo or the shower, that you don't feel like you've suddenly had a bit of a flood going on the floor or on the bed. So yeah, that can be quite a nugget of helpful advice, really. So what is your uterus actually doing when it's bleeding and the first bleeding after baby's born? Well, it's clamping down, and basically it is clamping down from the size of a beach ball to the size of a small pear. So it's got a lot of work to do. It's got to go from being an abdominal organ, so quite high up in your body, to a pelvic organ a lot lower down in your body, and it's going to go back down to its original size it was before you were pregnant. So understanding this can help you to understand what a lot of work that your uterus has to do in this period of recovery after birth. So a normal blood loss after the birth is up to 500 mils of blood loss. Anything more than that comes under the classification of a postpartum hemorrhage, or PPH, you might hear it called. And the PPH can affect women in different ways. So some women can lose greater than a litre of blood and be unaffected by this. So if you're losing quite a lot of blood, don't panic, don't worry. The doctors and midwives around you, whether you're at home or in a hospital or a birth centre, they recognise how much blood that you're losing, and there are things they can do to stop this bleeding from happening. Remember that in the UK, that it would be very rare for a woman to suffer any long-term damage from having excessive blood loss, just because we're a developed country and we have ways that we can slow blood loss and replace the blood volume that you might lose with either fluids or a blood transfusion. So as your uterus is contracting down, you might start to feel some after pains, we call them. So they can be like cramping pains. They're not really like contractions that you'll have had to birth the baby. I mean, they are contractions because it's your uterus contracting down, but they don't feel that way. They don't feel as powerful and as strong because your uterus isn't as big as it was when the baby was inside there. You need to think that the more babies that you have, that the more, sometimes the more of these after pains that you can have, and they can be quite powerful. In a first time mum, you often really don't, a lot of women just don't feel these after pains, but second time, third, fourth, fifth time mums tend to find that these after pains get a little bit more severe each time. So make sure that you tell your midwife and get some pain relief for that. When the time's right, you can have a warm bath and a soak to try and, alleviate that, or get somebody to get you a hot water bottle if you're struggling a little bit with those after pains. The after pains are a really good thing. So if you are struggling a bit, try and think of them as a positive thing, because what they're doing is they're clamping down all those blood vessels that were supplying your baby and your placenta, and they're clamping them down because they're no longer needed. We don't need all of that blood going to the uterus anymore. They're clamping down. The uterus is getting smaller and smaller. So try and think that whilst that's happening, that basically your body is doing exactly what it should be doing. It's good to, in the immediate hours after the birth, when there's bleeding, to still have that calm atmosphere, the one that we've talked about in previous antenatal videos, and we've got a video on oxytocin as well. So oxytocin is the hormone, and in order for it to stay high, to help your uterus to clamp down, it needs to have not a hectic carry on. You don't want hectic chaos around you, bright lights, people busy and doing things. You need to just keep the atmosphere really calm and, dim the lights down, snuggle in with your baby breastfeeding. That will help to generate the oxytocin and also help to contract the uterus down. So nature is very clever. When your baby is breastfeeding, it's supplying you with that oxytocin to clamp your uterus down and to stop the bleeding from becoming heavier. So in the next few days, there's not often a lot spoken about really in the next few days and weeks after the birth and what to expect with your bleeding. I think one of the most important things to recognise is bleeding after the birth is not like your normal period. So your normal period is the lining of your womb shedding each month, and it's a totally different thing to what is happening after the birth. So your bleeding is known as, you might hear it called lochia, and the lochia is basically the uterus, the contents of the uterus from the pregnancy, getting rid of all of that. So sounds a little bit odd, but it'll include your baby's skin cells, hair, amniotic fluid, as well as the blood that was in there, bits of vernix, the creamy substance that was on your baby maybe as well. So it doesn't look exactly like a period. It looks a little bit different in consistency, and it'll be bright red to start with in the first few days, and then it'll start to slow the flow of it. You might find that when you get up and you start moving about, so you'll be getting up, moving, doing things, and you'll get little gushes, because this will be sort of you just getting up and the blood again pooling a little bit and gushing out a little bit further. You may also find that when you're breastfeeding, again we've got that hormone oxytocin. When you're breastfeeding, it'll be clamping your uterus, so then you might find that you have a little bit more blood when you're breastfeeding. So look out for that as well. So you need just absorbent maternity pads. Like I said before, you can use those pants that will catch everything, which are great. They're disposable pants. You can use specially designed maternity pads, which have a heavier absorbency rate, or you can use washable maternity pads, which are fantastic and great for the environment as well. So those are available, and you can wash them, and you could use them afterwards as well for your normal period when that comes to. So the uterus is still clamping down, it's still getting back. It takes a while for it to start to come back down. You'll find that your tummy is still quite, a reasonable size. That's totally normal as your uterus, slowly starts to clamp down and get back to its normal size previously to before you were pregnant. So it can be very different for different people. So you can, one woman may only bleed for a few days, another woman may bleed for 3 weeks or more, and all of that is totally normal. What isn't normal is when you're bleeding excessively. So you want to make sure that you're not losing too much blood. Now, you can check this out with your midwife. She'll be checking in with you every few days, or you can phone your maternity assessment centre if you are worried. You shouldn't be soaking through a pad every couple of hours. That's not normal once you get to day 2, 3, 4. Soaking through pads and, blood coming onto your clothes and on a regular basis, you need to be contacting your midwife and, asking, to be seen, basically. You might also think that you're maybe not bleeding enough. Well, it can sometimes depend on the type of delivery that you have. Now, a caesarean section, if you have a caesarean section, you can bleed maybe more at the birth sometimes because it's surgery, and because your uterus has been emptied by the surgeon at the time, you may find that you don't bleed as much afterwards. Equally, if you've had an assisted delivery, you may find that you bleed a little bit more afterwards, just because it's all been a little bit much for the uterus. If the baby's just come really quite quickly in an assisted delivery, and it just needs that little bit of extra time to get back to normal and clamp down. You may also find that if you've had induction of labour, that your normal oxytocin levels aren't as high. So you may need the injection. Well, it probably is advisable to have the injection for your delivery of your placenta. And sometimes if you're bleeding a little bit heavier, then you may have an infusion, so that may go on for a few hours after the birth. That's just to keep that uterus well contracted down, so it doesn't go what we call a little bit boggy, so a little bit softer, and then it doesn't maintain its tone, and bleeding, it will bleed more if it's not really quite well contracted down. You may also find that if you've had a long labour, that your uterus potentially could be a little bit tired, and that you may bleed a little bit more. But your midwife will keep an eye on this, and if there are any concerns, then she'll contact medical help. And there are plenty of things medicine, drugs and things can do in order to get that bleeding down a little bit more. So I hope this video has sort of told you a little bit more about what to expect, immediately after the birth for bleeding, and what you'll need after the birth for bleeding, and then what you can expect in the next few weeks, days and weeks after, and also why the bleeding occurs and the hormones that are involved in controlling this bleeding. So you just gain a little bit more of an understanding of how your body is working, and how it works to clamp down the uterus and get your uterus basically to become a much smaller organ, from a very large organ that's housed your baby into a much smaller organ that is, what it was pre-pregnancy. Okay, thank you very much.